Welcome to Lyme Time. I'm Allie from the Tick Chicks. We are all more than Lyme disease and chronic illness, and together we stand with you to overcome and rise. I'll bring you closer to the experts in cutting-edge treatments and even a few unexpected ways of healing. I'll ask the questions you want answers to regarding Lyme disease and successful ways of getting you closer to 100%. We are in this together and will not be defined by Lyme. Hey everybody, welcome to Lyme Time. I'm Allie from the Tick Chicks, welcoming you to another episode where we bring the experts to you. And today I'm very, very excited. We are actually having Dr. Daniel Warren come back to us to this show. He spoke to us last time about Envita Medical Center and all the things that they do there. And we're coming back this time because he wants to talk to us about something that's working well for their Lyme disease patients, and it's called VSELS. VSELS, very small embryonic-like stem cells. And I've never had a podcast on this topic, and so I'm ready to get into the nitty-gritty with him. Dr. Daniel Warren is currently a practicing physician at Envita Medical Center, specializing in advanced natural medicine, chronic Lyme disease, and integrative oncology. He is a current board member, and he offers medical treatment, and he's on the review board for Envita Medical Centers of America. He's also an accredited unipathic physician. We'll get into what that is in a minute. And his medical specialties are infectious disease, Lyme disease, oncology, pain management, food sensitivities, endocrine disorders, including diabetes, hypo and hyperthyroidism, adrenal disorders, and autoimmune conditions. I am honored to have him back as a part two, and welcome to Lyme Time, Dr. Warren.
Thank you. Appreciate you having me.
I'm so glad to have you back, and I'm sure that we'll be meeting many, many more times in the future, but you have something really exciting to talk about today, which are called VSELS, and we're going to get into that in just a little bit. But first, I just kind of wanted to give our newcomers an overview of what is unipathic medicine. What do you mean when you describe yourself like that as a physician?
So yeah, unipathic medicine is it's essentially a platform that allows for better personalized testing, so personalized diagnostics and treatments for cancer and infectious disease patients. So it's essentially creating a medical blueprint, so to speak, where we're looking at, doing genetic profiling and how that relates to better testing and better treatment options for, these very difficult diseases like Lyme disease and cancer.
Got it. And how does it differentiate from an integrative medicine practitioner?
Well, I mean, we are definitely an integrative clinic in the sense that we utilize the best of both natural and conventional therapies. So, we definitely fall into that category in terms of being integrative medicine. But it's more thinking about, each patient as an N of one, essentially, meaning that every person is different, every person's unique, every aspect of their disease is unique. And so that's where it comes, where we as physicians, when we're putting together these lab recs, we're putting together labs to investigate root causative factors, and we're putting together these personalized treatment plans. We do so in a unique way for every individual patient. So
I think that's really good for everybody to note out there if you're having a trouble getting over the hump, so to speak. You may have something else going on, like mold toxicity or heavy metal disease, or even just, mold in your system or whatever it is. For me, it was chronic EBV that I just could not get rid of, and that was just kept triggering some Lyme symptoms. So you never know what's really the root cause until you go to a special place like this. And then for anybody who doesn't know or isn't familiar with Envita, could you give us sort of a bird's eye overview of Envita, what the center itself provides, and then what you do at Envita personally?
Yeah, happy to. So Envita is a clinic that was established going on about 25 years ago by our founder, Dr. Dino Prado. And his mission and the mission that we've carried forth since the inception of the clinic is, this personalized medicine approach where we're trying to get to these root causative factors that you mentioned and really see the most market healing that we can. And so, our mission, our goal is um, to see the most healing possible, and we do that through this personalized approach. We use a variety of tools. One of the things that I feel really lucky to say as a physician in Envita is that we have a really big tool belt. And as you can imagine, it's a necessity because we have these very personalized approaches and every patient is unique and gets a different treatment plan. We have to have a lot of tools in order to customize them in that way. So for us as physicians, it's amazing to be able to do that, but it also yields, the best results because we are treating each patient's disease as a unique disease set, and as a unique person. So, obviously, I'm love working at Envita. I've been there a long time, and I'm a huge fan of the company and the mission and the people. It's a really, really special place. My role there, in addition to seeing patients myself, is I manage the team of physicians who oversee the care of our patient base. So, somewhat more on the management side these days, but definitely still on the patient side as well.
That's incredible.
Yeah.
And how many Envita centers are there nationwide?
So currently there's just the one. Um,
And that's
you
in the
know,
Arizona area?
Correct. Yeah, we're in Scottsdale, Arizona. We in the past, as we have expanded and grown, have toyed around with the idea of opening other centers, and I think that's still a possibility in the future. But one of the things that I think that makes our clinic so special and unique is the people who work there. It's the patients that we see, and one of the challenges in having multiple centers is to replicate that family and community and the people that we have as part of our company without losing the integrity as you expand and open other centers. So I think that's definitely possible in the future. But right now it's just the one clinic in Scottsdale, Arizona.
Well, what I love about it is really a one-stop shop. And from what I understand, it's not unlike different centers around the world where the patient will actually travel to you and then stay there in the area for a while and get the treatment.
Correct.
Sort of about how long does the average Lyme disease patient stay with you?
So I would say the average protocol is about 8 weeks. So it's about 2 months, which, as you said, patients come from all over the country, all over the world, and they do essentially move, and they move to Arizona for that time period in order to get treatment. And the reason why we're in Arizona and we require that patients are here for that time period is because of the physicians that are on staff and the physicians that we have, it allows us to do the very specialized therapies, mostly IV therapies that we do that we wouldn't necessarily be able to do in other places. But we have an amazing team of docs that all have different expertise and specialties, and it's really an honor to work with them.
Yeah, and I get asked the question all the time, what's the benefit? Why do people go outside the country to either Mexico or Europe to get different treatments and everything? It's not necessarily that the treatments are different. It's
Mhm.
that they can somehow wrap their mind around going somewhere for a month or 2 months that's the kind of care they need, and that's why they get great results, is because they're not getting sort of stabbing at little treatments along the way and blood work, and spread that out over a year to 2 years time, and trying a treatment here and guessing that. You basically take all the guesswork out of it for each patient. They just have to have the commitment to come to you for a couple of months and really dedicate their themselves and their mind, body, and soul to really getting things under control, and then they're better able to go out into the world, as it were.
Yeah.
But again, it's not necessarily that any treatments are better out there in the world. It's just that people, there aren't that many clinics, quite frankly, in the United States, where you can get long-term, specialized, concentrated treatment. And I think it's especially interesting that you treat not only Lyme disease, but cancer. But those are the two areas of expertise at Envita. So just throwing that out there for everyone. Um, and your center does a lot. We've talked about different types of research and findings and treatments that are actually beginning to work for Lyme disease patients. And I'm sure that you've had many iterations of those types of treatments over the last 25 years. But what's new and what we really want to talk about today are VSELS, which stands for very small embryonic like stem cells. VSELS. And so we are all ears right now. I want you to walk me through it from the beginning, middle, and end about what is going on with this and how it works in your body, and then the types of results that you're seeing.
Absolutely, yeah. So V cells, as the name suggests, it's a very small cell that's acts essentially as a stem cell. These have been known. They were discovered decades ago, but their true potential and purpose weren't really found and discovered until more recently. There was a PhD out of Johns Hopkins University who essentially did experimentation with these cells and realized the regeneration and healing potential of them, and created this model to not only activate them, and I'll talk to you in a second about them being inactive versus active, but not only to activate the cells, but also to be able to mobilize them to different areas in order to have them unlock their regenerative capabilities. So these cells basically they are really unique in the sense that even though they act like stem cells, which I think most people are familiar with, one of the things that makes them really unique is that they are inactive in the body, unlike other types of stem cells, which are oftentimes activated from birth. Um, and these can stay in an inactive state for your entire lifetime. They're usually activated naturally in cases where there's a need, meaning there's been a trauma or some kind of event that happens where the body will then activate them. But the really kind of cool and unique thing is that when they're in that inactive state, they're essentially impervious to damage. So that's really unique because unlike other types of cells, which is pretty much as soon as they're active for the majority of your lifetime, they're going to be damaged by things like radiation and other toxicities and things in our environment that we get exposed to, which potentially can compromise that functionality of those cells. Whereas these will basically stay completely impervious to those stimuli until they're activated. So that's really unique and really important because essentially what this doc did is he created this technology using this very sophisticated laser to then activate these cells. So the process basically they're found in your blood. So similar to things like PRP, for those that are familiar, platelet-rich plasma, which is kind of a common, becoming more of a common thing in terms of direct injections into joint spaces and things like that for regenerative capabilities. So this is found in the platelet-rich plasma, these cells. And so essentially they're in your blood. You take a sample of blood, you can harvest these V cells, these inactivated V cells from the blood, and then using this laser technology, not only does that then activate them, but you can then direct those cells to the area of the body that you want to go. One of the things that's also important to note about these cells is that they're called what are called pluripotent, which essentially means that they can become any cell type in the body. So they're not defined as a specific cell type. They can become any cell type. So if it's musculoskeletal regeneration, if it's neurological regeneration, if you direct them to that area of the body, to that system, then they can become that cell type and lead to tissue regeneration. So really, really powerful capabilities in terms of the regenerative side, in addition to causing regeneration of tissue. When you mobilize them to a certain area, they also stimulate the immune system. So specifically, they stimulate natural killer cell production. So there is utility as well on the cancer side. Mostly, quite honestly, we've used them more on the Lyme side because of the regenerative need for Lyme patients where you have damage that's done from the disease. But because of the immune stimulation potential, there's utility there for cancer as well, as essentially an immunotherapy. So that's really, really exciting. And basically, when we went through the training to utilize these, we had the doc who created this technology, and he gave us all of these case studies of these really rare diseases, most of them neurological diseases, and essentially where conventional medicine had nothing for these disease states and these patients who are suffering, and just seeing these amazing results utilizing these cells. And so another thing to mention is that they are autologous, meaning that they come from your own body. And that's important because whenever you're injecting something into the body, whether it's intravenous or it's directly into a local area like a joint, you want to make sure that it's, if possible, that it's coming from your own body because you reduce the chance of rejection, right? Whenever you inject cells from other people, or sometimes you can do stem cells from placental tissue, embryonic or umbilical cord, adipose, from various sources from other people. Essentially, it's called allogenic cells. Then you run that risk of rejection of those cells from the body because they're not your own cells. Well, these are directly harvested from your blood. They're your own cells. They're basically just activated and then mobilized to a certain area. So you don't have to worry about that problem that you see with some other types of stem cells where they come from other sources. So that's certainly of benefit. In terms of outcomes that we've seen, we had kind of a cohort of people in our Envita family that received them. I was actually one of them that received the stem cells. So I can tell you about my personal experience.
Let's
But
hear
we
it. Let's
had,
get into it.
yeah, absolutely. So I've had
Were you treating for anything specific?
I was, yeah. So I've had chronic neck pain and migraines for years, and it has worsened over time to the point where I was getting migraines multiple times a week. And so I kind of pitched myself to be part of this initial cohort, and what they did essentially is they harvested the V cells from my blood. And then our interventional radiology team, who does a lot of our intratumoral injections for our cancer patients, they're the ones who deliver the V cells as well. They did suboccipital injections, so in the neck muscles below the occiput and the back of the neck, directly injected there on both sides. And then they did intravenous as well, so through the arm, systemically, and then use the laser to essentially do a cranial and neurological protocol. So I received it one time. The process took about an hour. It was pretty quick. Interestingly, and I have seen this with other people who have received them, that you can have a little bit of a Herx-like response, meaning like within the first few weeks, you can actually feel a little bit worse sometimes. Not in every case, but I did experience that where my neck pain was actually a little bit worse. And then After that, within the first couple weeks, I would say, and this has held since then, this was probably about 8 months ago, something like that, where I've had about a 70% reduction in my neck pain and migraines, frequency of my migraines. So not only did I see a huge change in terms of, my chronic pain, but it's held. It's been consistent. And that was one of the questions that we had asked, the doc who had created this technology was, is this a short-term thing? Is it a long-term thing? And he said in almost all cases, it's long-term. Um,
Wow.
so yeah, for me personally, I saw fantastic results. We had other members of our Envita family who received them and had great results. One of which was type 1 diabetic who basically was on the same insulin dose his entire life. And within 12 hours of getting the V cells, he reduced his insulin by 20%, which is pretty amazing when you think about, because essentially type 1 diabetes, for those who aren't aware, it's a destruction of the beta cells in the pancreas. Once those cells are destroyed, it's thought that they're not coming back. There's the permanent destruction. But clearly he had regeneration of some of those beta cells because he, for the first time in his life, didn't need as much insulin, which was pretty amazing. So there's amazing potential here for a lot of different cases. Like I said, the doc who trained us on them, who created the technology, has used this from a variety of patients, some Lyme patients with neurological dysfunction, but a lot of other diseases like MS and ALS, and even some really rare diseases that most people haven't even heard of. So just amazing regeneration potential, and of course, we're very excited and grateful to have this tool. And I think there's a ton of utility for Lyme patients. Now, the thing about Lyme is that when you see that inflammation and that tissue destruction from Lyme disease, sometimes that is temporary, meaning that the body can heal itself once you go through the process of removing those root causative factors. So you get rid of the infections, you get rid of the other variables that are playing a role in the dysfunction of the body, and you can see that function come back. Sometimes, however, especially for more severe cases or patients that have had this for decades and many, many years, where there's been just a long-standing history of destruction, you need additional pieces of the puzzle. And that's where I think V cells can really make a difference in combination with doing the things you need to do to get rid of those underlying causes, and then potentially coming in and helping the body and immune system really to regenerate, can be huge for that long-term success. And of course, that's what we all want.
Yeah, and sort of, I'll try to ask the questions that I think people want to know. My
Sure.
initial response is, okay, so Lyme has been, let's say I'm experiencing chronic Lyme. It feels systemic to me. It feels
Yeah.
like it's all over my entire body. How would I possibly target one area over the other area in terms of these cells being, injected where they are?
Yeah, great question. So it doesn't have to be localized to one area. For me specifically, that's where we focus because that was my main issue. But to your point, for most Lyme patients, it's a multi-systemic disease. You're dealing with multiple systems of the body that have dysfunction. So oftentimes when you're dealing with a lot of areas that could use some benefit, could use some regeneration. You don't have to just do one at a time. You can do multiple systems simultaneously, but you might need more than one treatment to address those areas, meaning that let's say you want to focus on some neurological dysfunction and regeneration of the neurological system, but there's also some gut issues and there's musculoskeletal issues. Well, you might not be able to do all of that in one shot. You might need two or three or more treatments in order to hit all of those areas.
Got it. Okay.
Yeah.
Second question.
Yeah.
I could see somebody saying, surely my blood is infected. Like how many good cells do I actually have left after having chronic Lyme for, let's say, 10, 20 years? are you sure I'm even going to have this capability left in my bloodstream, in my cells?
Yeah. Yeah, and it's a good point because especially when we're thinking about other types of immunotherapies where we're harvesting your own white blood cells and those kind of things. Well, if your cells have poor capability because there's dysfunction in that system, then that's a good point that sometimes that can impact the efficacy of that treatment. As I said, the nice thing about V cells is that when they're inactive in your blood, they're impervious to infection and other offending agents. So no matter how sick you are, you're going to have these inactivated V cells that have the same potential than anybody else would have, whether you're healthy or not. So that's the really great thing about this is that it has the same potential in everyone, no matter how sick you are or how sick you've been.
So everybody can be a candidate that has Lyme disease.
Yeah.
That's so incredible. Sometimes we
Yeah.
see ourselves as patients, as especially after having it for so long, that surely by now it's infiltrated every tissue, joint,
Hmm.
muscle that I even have. So that's really good to know that yes, we have been created as perfect human beings to actually help our own selves out, get out of disease. And I love that it's not injecting chemicals and compounds and radiation and all this stuff that we've sort of been accustomed to dealing with. So
Right.
I love this. I love this concept of using your body to heal your body. My next question is, okay, let's talk logistics. I'm in, I know it's going to last an hour. What does it look like? Give me a step by step. What can a patient expect? I'm imagining something withdrawn from your body, and then what do you do with it? And then getting it back into your body. Tell me everything.
Yeah, okay, sure. So as I said, we do it at our interventional radiology center. So basically they draw the appropriate number of vials of blood. Typically it's six, but it can be up to 16, depends on the prescription from the physician. And we have a very, very specialized centrifuge that essentially you put those vials of blood in that centrifuge and it spins down the blood. And then those V cells are at the top of that solution. So then once that is done, and that process, if I remember correctly, takes about 20 minutes or so. And then the tech will then extract those V cells from that layer where they're now separated. And then depending on the protocol, whether it's just a systemic protocol, meaning that they're all going to be IV, or then they will be re-injected through the arm. Now, obviously, a little bit different for our patient base because we do require a central venous line. Because we do so many IVs for our patients, we don't want to poke you every day. Your veins wouldn't hold up over months anyway. And so for those patients, we can utilize those lines in some cases. But for patients that don't have a central venous line, then we kind of re-inject them back into the body through the arm. And then if there's direct injections, then obviously those are directed by the interventional radiologist. And then we have our nursing staff and our techs that essentially use the laser, and there's different protocols depending on what system of the body that you are targeting. So, there's a neurological protocol, there's a musculoskeletal protocol, there's various protocols that they will utilize using this laser to direct those to specific areas. Now, obviously, if there is more localized damage, meaning that there's a specific area that's been damaged that you want to focus on, then obviously that's where the tech is going to focus that laser. The other thing that's kind of interesting is that they are, and you might have heard of kind of experiments that they've done in the past in terms of, playing music and looking at how music affects molecules on a
Yeah,
molecular
yeah.
level and how
Frequency
it can
healing.
affect, yeah, frequency and that kind of thing. So there is actually one of the things that the doc who created this technology did is he experimented with a lot of different frequencies of music to see how that affected the cells, and then essentially created um, playlist, so to speak, for lack of a better term, with specific frequencies and music to help activate the cells as well. So there is kind of a frequency component as well, in addition to the manual direction of that laser to various areas of the body. So that whole process of, the laser protocols, depending on and the timing of it will depend on how how complex the protocol is, whether we're doing one system, whether we're doing four systems, and that will dictate the length of time. But like I said, it's usually about an hour or so.
Yeah. Wow. Fascinating. And
Yeah.
just going back, the laser is after the injected, it's injected back into your body, then they do the laser, or do they do the laser before to like stimulate that?
It's mostly after. So you get them back into the body essentially, and then you direct them with the laser afterwards. Yeah.
All right. Next question.
Yeah.
Once they're put back in my body and activated, can they duplicate themselves there? Or is it pretty much you're getting what you get, and then if you need another treatment down the road, you just start over?
It's a good question. From my understanding, it's more about, I don't think there's direct activation of additional V cells from the V cells that have been activated. But as I said, there is an activation of other cells. So you can get activation of natural killer cells and other white blood cells. So there is certainly an immunologic response that happens. So there is an activation from those activated V cells. But my understanding is that it doesn't activate additional inactive V cells.
Got it. Got it.
Yeah.
Okay. So they're just in there doing their job. And then if you should you need to repeat it, it sounds like it's pretty long term. We don't know how long term it is, but I mean, what the maximum patient has gone without a recurrence of symptoms, but hopefully it's a lifetime of relief there.
Yeah, so like I said, it's from my experience and from the training that we received, it's very promising that this is a long-term result. This is not something like, you get a Prolo injection, and it lasts you a month or something, and then you're back to where you started. That hasn't been my experience with these, which makes it even more exciting that you get this long-term benefit.
Absolutely. And the fact that it's fairly non-invasive is what
Yeah,
really interests me too. Do you
sure.
see at any point in the future, do you see people sort of taking this home, doing their own injections, that kind of thing in the future, or will it always be done in-house?
I think honestly, I mean, obviously anything's possible, but I think probably in the way that I kind of look at it, just because it is somewhat practitioner dependent, meaning that there is a skill component. You need to kind of know what you're doing and being able to utilize that technology appropriately to get the most benefit. So I do think it's something that is best served in a controlled environment with trained professionals.
Mhm.
But anything is possible, of course.
You never know.
Yeah.
Is there anything else you'd like to say about the V cells or Envita, or even just speaking to the Lyme patients out there, just in closing, and just any final thoughts?
Sure. Yeah, I did want to actually mention it. I did have a further thought about the V cells that I think is worth mentioning. And then I'm happy to kind of talk a little bit more generally as well as a closing. But one of the other thing that the doc had talked to us about is, and this is where he did additional research in terms of doing lab values, to essentially look at biological age. So there's a variety of markers that you can look at in terms of measuring biological age, which is different than your actual age, because this is essentially on a molecular level, on a cellular level. What is the age of your body based on a variety of different metrics. And what he found, I mean, essentially, this isn't necessarily what we're using it for, but he's utilized this on athletes and other people who aren't sick and are high performers, and found that there is a drastic reduction in biological age with the V cells as well. That a lot of these markers that are tested to assess that decrease dramatically with this treatment. So that's another thing that's really potentially exciting, is that we're seeing this fundamental healing on a molecular level. even when you're thinking about it outside of the context of Lyme patients, which of course is why we're here. He also, is experimenting with, benefits for cosmetic purposes and anti-aging and those kind of things from, that perspective, which again isn't necessarily what we're using it for, but the point being is that there's a lot of potential utilities for this technology that can, be really beneficial for people. So.
And does the patient feel that? Like, do you feel like a 15-year-old again? Or, I mean, do you have that energy, or is it just basically on a cellular measurement level that actually your cells are operating at a much more optimum level?
Yeah, so from at least the data that he shared, because again, we're not testing it on this population, but for the data that he shared in terms of the athletes, these high performers and people that were very healthy, he found that absolutely increased their performance, that they had more energy, that they were able, more stamina, that they were able to perform at a higher level, which, for us non-athletes, I think that, it certainly bodes well in terms of the benefit for us. So
Yeah, I'll see you in the next Olympics. That's
yeah,
real good.
exactly. So there you go. You're welcome.
Well,
Um,
yeah, and any final thoughts that you might have?
sure. Yeah.
Or,
So I mean,
or words for our, for you mentioned, infectious disease and when you're a center that specifically targets cancer and infectious disease, which would include Lyme disease and co-infections. What are you seeing out there with your patients now?
yeah, I mean, it's interesting because we definitely saw this previously in cases, but I feel like we're seeing more and more cases where there's a combination, meaning that there's an infectious disease component and cancer or an increased risk for cancer, and so we are treating a lot more patients than we have in the past that have both, and sometimes they come in with a diagnosis of both, and sometimes we're diagnosing one or the other. But that's very interesting. To think about in terms of, patients needing help in multiple areas. And I think that's where sometimes that expertise can play a big role because we can delve into these multiple areas of not just focusing on Lyme disease, but autoimmunity and some of these neurological conditions as well as cancer when it's appropriate. So that's definitely an interesting thing. And one thing I usually like to kind of close with and to talk to patients because we are the type of clinic where we're typically not the first stop, we're usually the last stop, and we usually see very complex cases by the time patients get to us. And when you've gone through this journey of trying to find answers to why you feel this way, and then finally finding that answer, and then not being able to get the help and having your hope kind of dashed multiple times. I unfortunately hear that story a lot. But I always like to remind patients that not just with us, but there is hope out there. That this is a disease you can heal from, and I think that's the most important thing when you think about Lyme disease is just you lose that hope as you go through this journey of trying to heal and trying to get better, and being able to remember that you can heal, that you're worthy of healing, and that it's possible. It makes a big difference. So
Yeah, very, very powerful words to live by. And to everybody out there who's, in bed listening to this or, getting a treatment, listening to this podcast, just keep going, keep learning, never give up. There's always another possibility out there. I promise you that you haven't tried yet or that your body hasn't been ready to try yet, but you can experience total healing. I'm a living example of that. So thank you
yeah,
so much, Dr. Warren, for coming back. I'm sure we'll see you again in the future on all the wonderful things that you're doing and the latest in treatments for Lyme disease. Really appreciate
yeah,
you coming,
yeah, absolutely. My pleasure. Thank you for having me again.
of course.
All right. Take care.
Bye.
Thank you for listening to this episode of the Lyme Time Podcast. If you like what you heard, please subscribe on your favorite platform to be notified of new episodes. Remember, this is not intended to be medical advice. Take your findings to your provider to see if something is right for you. No two bodies heal the same, and your doctor knows you and your labs best. You can find out more about the Tick Chicks at thetickchicks.com, and if you subscribe there, you'll be notified of upcoming events like the in-person Losing Lyme retreat that I host. I also have shopping pages dedicated to helping your at-home symptom relief, as well as a private support group. Join the Tick Chicks tribe on Instagram, YouTube, Meta, TikTok, Pinterest, and X. You are not alone.